Welcome to my YouTube channel, TheCosmicNp. I am absolutely thrilled you're joining me today for a highly requested and honestly, deeply important explainer. We're going on a comprehensive, academic deep dive into something that's quite literally making history in the healthcare landscape right now. I'm talking about the newly launched Doctor of Nursing Practice, or DNP, degree in India. This is an absolute game changer for nursing professionals, and today, we're going to explore every single facet of this historic program from start to finish.
To make sure we cover all the bases, here is our roadmap for this explainer. Section 1, Introduction and Historic Launch. Section 2, Admission Pathways and Eligibility. Section 3, Clinical Practice and Curriculum. Section 4, the Scholarly Practice Project. And finally, Section 5, Future Scope and Challenges.
Okay, Section 1, Introduction and Historic Launch. Let's dive right into this and lay down the foundation.
So, what exactly is the DNP? Well, the Doctor of Nursing Practice is a newly introduced, entirely practice-focused doctoral degree. It was officially launched by the Indian Nursing Council, and its main goal is to prepare nurses for the absolute highest level of clinical practice, leadership, and healthcare management. You know, this is a terminal degree. That means in the realm of clinical nursing, there is literally no higher educational peak you can climb.
And this brilliantly illustrates the real shift here. If we compare it to a traditional PhD, which as we know is heavily research-focused and culminates in a traditional research thesis to create nurse scientists, the new DNP is totally different. It is practice-intensive. It's built for the front lines, culminating in a scholarly, practice-based evidence project. The whole point is to take the highest level of clinical knowledge and apply it directly to improving actual patient outcomes.
Now, the INC didn't just launch this out of nowhere. They set international benchmarks from day one with an inaugural pilot program that took off in October 2024. They teamed up internationally with the University of Houston's Andy and Barbara Gessner College of Nursing. And on the Indian side, this historic launch happened at two highly respected institutions, the Mahatma Gandhi Mission Institute of Health Sciences, or MGMIHS, in Navi Mumbai, and the Christian Vishwavidyapith Deemed University, or KVVDU, in Karad.
Let's move right along to Section 2, Admission Pathways and Eligibility. Let's see what it actually takes to get into this program.
First up, I want you to keep this number in your head, 40. The overall program structure is extremely rigorous. It consists of 16 comprehensive courses that total exactly 40 credits. The INC designed this with some flexible entry points, sure, but make no mistake, the academic weight of those 40 credits is universally demanding for anyone who enters.
Now, what's really interesting about this slide is the highly specific eligibility criteria. We basically have two main entry pathways. If you're going the postmaster's route, meaning you already hold an MSc in nursing as an MPCC, you can do this as a 2-year full-time or 3-year part-time program. But you must have scored a minimum of 60% marks in every single subject, have at least 2 years of critical care experience, and be actively working in a specialty hospital or ICU right now. Alternatively, for the post-BSN candidates, it's a dedicated 3-year full-time degree spread across 6 semesters.
All right, Section 3, Clinical Practice and Curriculum. Once you're in, what are the actual expectations?
A major thing that sets the DNP apart is the intense, hands-on clinical demand. You're definitely not just sitting in a lecture hall. Your training has to happen in a medical college hospital or a tertiary hospital that has comprehensive ICU facilities. On top of that, there's a mandatory residential experience and extensive clinical practicum hours. You are literally living and breathing advanced practice in a high-acuity environment.
And the curriculum pushes you way beyond traditional nursing education. DNP graduates have to deeply integrate advanced sciences like pathology, pharmacology, and ethics right into their daily practice. But it's also about systems leadership. You're learning to design new care delivery models, lead organizational quality improvements, and master analytical methods. You'll harness complex healthcare technologies and get heavily involved in healthcare policy and population health. It's about building leaders who can change the system from the top down.
Moving on to Section 4. The Scholarly Practice Project. This is where all that leadership focus comes together.
Forget the dusty traditional thesis. To graduate, you have to complete a final project that results in a tangible, real-world healthcare improvement. There are 4 accepted formats here. Number 1, quality improvement projects, finding a flaw in current care and actually fixing it. Number 2, practice change initiatives, which means bringing new evidence-based methods straight to the hospital floor. Number 3, program or practice model evaluations to see if what we're currently doing actually works. And number 4, research utilization and systematic reviews, taking academic research and finally applying it to real human patients.
Which brings us to our final section, Section 5, Future Scope and Challenges.
So the crucial point is, where do these graduates fit into the workforce? Well, the career outcomes are firmly top tier. Graduates act as advanced practice nurses with significantly higher competencies. They're perfectly primed for clinical leadership roles in quality, policy, or executive hospital management. Plus, they are desperately needed as teaching faculty for the next generation, making them uniquely qualified for dual-role leadership that perfectly bridges education and clinical practice.
And we have to remember the overarching strategic objective here. Why was this brought to India? It's a bold, strategic move designed to solve India's critical, ongoing shortage of primary care providers and advanced nursing leaders. It's a very real solution to a very real national problem.
But let's look at the full picture impartially. Because this program is so new, graduates face some real-world systemic barriers right now. Regulations are still evolving, which means the legal framework for completely autonomous practice is a bit unclear. There's also limited independent prescribing authority for nurse practitioners in India at the moment, and of course, there's an ongoing need to gain wider acceptance from hospitals and physicians to really standardize these career pathways.
So, this brings us to a fascinating crossroads. As regulations inevitably evolve, how will the DNP transform the future of autonomous nursing practice and healthcare delivery in India? Will our system adapt quickly enough to actually utilize these highly trained experts? I really want to hear what you think. Drop your perspectives, your experiences, and your answers in the comments below. Thank you so much for joining me on The Cosmic NP for this explainer. Keep learning, keep advocating, and I will see you in the next explainer.